As we talk about hybrid, I think it's important to know and understand where we are with the numbers. They're not getting any better if you haven't noticed, but we're in the heart of moderate. So right now, as a moderate in Allegheny County, we can go hybrid or virtual, and I think you know we're in hybrid. So right now, if you look at this, there's two categories that keep us in moderate. It's 10 to 99 cases per 100,000. We're in the 50s right now. So we're right in the middle of moderate. And a positivity rate of anywhere between 5 to 10%. We're in the 7-8 range daily. So we're not even close to low, which is where you would be able to begin to have the conversation about a traditional school setup. So I wanted everybody to kind of know and understand that this is the first piece of the puzzle when we start to look at the next step. When you look at the next step, this chart shows where we are in Allegheny County over the last 7 days. And it's where I just said, we're in the 50s. So today we're at 54 cases per 100,000. There's 1.2 million people that live in Allegheny County. So this is the Allegheny County number. So right now, when you do the math, you're at 54 cases per 100,000. This has to get below 10 for us to get to green, full traditional. And we're at a positivity rate of 7.3%, 7.39%. That has to get to less than 5. And they both have to be there, not one or the other. And that's how you get from moderate to low, which then allows us to do a traditional schooling. Okay, so those are important numbers to kind of pay attention to. As we're in hybrid, I mentioned the first time we talked about hybrid that we're getting into the holiday season and our calendar is about to get chopped up. So I know Heather's done a nice job of placing this calendar on our website so people kind of know and understand what to expect as we get into those holidays and the shorter weeks. Like, for example, we have Act 80 days coming up the first Monday and Tuesday of November as we have the election held in our buildings. So we don't have students on those days. So if you look at that week, Wednesday is an A day. Thursday is a virtual day, and Friday is a B day. And as we approach the Thanksgiving holiday, we are off Wednesday through Monday. So on that week, Monday is an A day, and Tuesday is a B day. There's no virtual learning. And you can see as we return from the Thanksgiving holiday, it's Tuesday, Wednesday, A, Thursday, Friday, B, no virtual learning that week. So this calendar is going to become very important to know and understand what day I can be physically present in the school as we enter into the holidays and the shorter weeks. Same thing's going to happen. January is not on here, but we return on Tuesday after the holiday. And so that will be a week that looks AABB. And we'll get to that calendar, a little bit later. But right now we have October, November, and December that's out there. So please pay attention to this calendar so that we know what days our students are to be physically present in the school. So talking a little bit more about a move from blended to traditional, and I talked a little bit about those case counts, which is a big part of this, but at the same time, I think it's really important to know that there's two major factors that are going to prevent us from going to traditional or a blended model for any time soon here, and that's the fact that I cannot get kids 6 feet away from each other or 6 feet apart from each other in a classroom as we begin to add capacity. If we did full capacities in the classrooms, if we did a blended model where they left half day, or we did a full traditional model, I can't get them 6 feet apart in a classroom. I can barely get them 3 to 4 feet apart, and some of our classrooms are shaped differently than others. Some of them are smaller than others. That presents the first challenge for us. The World Health Organization says that when you get to 3 feet, you reduce your risk to exposure by 80%. But the CDC and the state of Pennsylvania is still requiring us to be 6 feet apart in social distancing. So just right there, to double our capacity, is not, we fail. We can't do it in our classrooms. And the second and most important part is the cafeterias. We had to think outside of the box to get the cafeterias to work in the hybrid model. I think in 3 of our 4 elementary cafeterias, students are at desks in the cafeteria, and we maximize the amount of desks we can put in there. And so to double that capacity is an impossibility. So there would be no way that we could have our students eating in the cafeterias if we went to a more traditional model. Which is why in our blended option, they go home at lunchtime. Okay, so right now, we're in hybrid. I think hybrid is going well. And until our numbers take a turn for the better, I think we're going to be in hybrid for quite a while. Okay, so that's just me kind of being realistic about what I see in front of us with the numbers, the testing numbers, the cafeteria, and the classroom setups. Pleased to announce that we have a COVID tracker that you can now kind of go along with on our website, and it'll give you our active number of cases. Unfortunately, we have an active case now. I know that was communicated out today. Under the CDC guidelines, those cases are active for 10 days through a 10-day isolation period, and so that's why you can see we have 1 active case and 6 total cases, because if you were paying attention over the last 6 weeks, we had about 5 different cases that came through at different times. All of those have been communicated through Mrs. Pellet's office, and we put this tracker out there just so that people had an awareness of this is where we are with active cases, this is when they occurred, and this is what building they're located in. So this tracker is available on our website, and if you click on that link there, it'll take you right to the tracker that you can see right in front of us. So the next category is about when will we close. So this has changed a little bit over the last couple of weeks as more and more schools have gone into operation. So this is basically up to Allegheny County Health Department. And so we could have multiple cases in a school, and they would not close us down. They would begin to close us if those cases are linked or a result of each other. So the possibility exists that you have students that are positive or teachers that are positive that are not connected to each other. And so therefore, the department might not shut us down. And so whenever we get a case, we have a contact with Allegheny County Health Department. We talk through all the cases, all the situation, who's close contact, and they try to contact trace that to the result of the case. If it's us, we're going to get shut down. If it's not, there's a chance we won't. So that's the good news about these numbers, because if you looked at the way it is just by looking at a chart, and we're moderate, and 2 or more students or staff members are positive, you close for 5 to 7 days is what the chart says. But if those 2 students or staff members aren't related in a case, then they're not going to shut us down. Okay, so that's some good news about how this is going to operate moving forward. And this slide is sort of what I just said about Allegheny County Health Department does all the contact tracing. I think that's important to know. The North Hill School District does not quarantine anybody. That's not our job. We won't contact you to be quarantined. That's not our job. Our job is to work with Allegheny County Health Department as they contact trace, answer all their questions, help them to make sure that the community is staying safe under this crisis, and they will communicate who's quarantined and why. I don't think we have the authority to tell somebody they have to stay in their house and away from everybody for 14 days. That's not our responsibility. That's the Allegheny County Health Department's responsibility. Okay, so it's important for us to know if there are cases, because then we can help parents with quarantining and with the appropriate education plans and those types of things. And I commend a lot of parents have contacted me to say, my child was in this situation and they have to quarantine. What should I do? My child was in this situation. They haven't been in the school since this date. What should I do? So I commend those that have reached out to us and helped us through this whole thing as well. So please don't hesitate to contact us and talk. I'll be happy to talk to anybody about what they should or shouldn't be doing. And if I can't answer you, I'll give you Allegheny County Health Department's number and they can help you with it as well. So I just want everybody to know that other districts are quarantining people. That's not our job. It's not our responsibility. Our responsibility is to work with the health department and educate kids. That's our responsibility. And that's the job that we're going to do here. So I've said this a bunch of times. I just want to reiterate it again. Our kids are in school, and I want them here, and so do you. So please keep doing the things we have to do to keep them in school. Wear your mask, follow social distancing guidelines, wash your hands, stay home if you're sick, and if you can get a flu shot, please get a flu shot, because once these viruses start to mix, we're not going to know what we're dealing with. Are we dealing with the coronavirus? Are we dealing with the flu virus? Is it strep throat? What is it? We know that we're in that season right now. Just please be cautious and please be understanding of your own personal feelings and symptoms. And if you're sick, stay home. If your kid is sick, please keep them home.